In today's Health Watch, women and heart attack symptoms. A new study finds women are more likely to have a heart attack without chest pain, so they're less likely to get immediate treatment. They are also more likely to die in the hospital, especially when it comes to younger women.
Dr. Laura Mosca is Director of Preventive Cardiology at New York Presbyterian Columbia Medical Center, and I'm pleased to have her here this morning.
Thanks,
What's
John.
the significance of this, especially for women?
Well, this is really important news for women because they need to be aware that the symptoms of a heart attack may be different than they might expect. It's not the classic Hollywood heart attack, and it occurs, the less common symptoms occur more frequently in women than they do men.
So what's the message for women? What should they do knowing that this is the reality?
Well, the most important thing women need to do is to be aware of what we call atypical symptoms of a heart attack are, because when they're aware of those symptoms, then they're more likely to take the appropriate action. This study was actually important because it linked not knowing what those symptoms were to having worse outcomes.
So but we do know what some of those symptoms are. So what are things that we can be aware of?
Yes, so important to be aware that lightheadedness, for example, shortness of breath, pain in the upper body that can radiate to the neck, the back, the arms, indigestion, stomach upset, generally just breaking out into a sweat. And the other thing that a lot of women aren't aware of is overwhelming fatigue is a symptom of a heart attack.
These are all things that are tough for women to grab onto. We talk about all the time how women treat themselves last. Are they also using the right terms when they go to see their doctor? I mean, what are things we should be saying so that we're paying attention to the symptoms in the right way?
Well, that's a very important point, Erica. I think when we go to the doctor, the first thing we need to do is to be really informed about what our risk factors for heart disease are, because then we can put these symptoms in context. As you pointed out, busy mom, you often will feel fatigued, you might be a little bit lightheaded, you didn't eat that day. So it's important to put the symptoms in context. Know what your risk for heart disease is. Know your risk factors.
Here's what I don't understand. Why is it different for women than men?
Well, Charlie, I wish I knew the answer to that. We don't actually know why women present more with more unusual symptoms of a heart attack. But this study was important because it showed there was an important gender difference. About 42% of women, when they had a heart attack, presented with non-chest pain symptoms, and only 30% of men. We don't know why.
So what are possible explanations, even if you cannot confirm them?
Right. So there is a theory that the biology of heart disease in women might be a little bit different, that our plaques are different compared to men, and this might explain it. Women also with diabetes tend to have different symptoms, and women may have more diabetes than men, and that may influence how they experience chest pain. You're
engaged in preventive heart care. The main thing is don't smoke. The main thing is watch your diet. What else? Well,
absolutely important. I always say the three most important things about preventing a heart attack are lifestyle, lifestyle, lifestyle. As you point out, don't smoke, eat a better diet, and importantly, get up and move, regular physical activity. And these two things, nutrition and exercise, affect one of the most common risk factors for having a heart attack, and that is being overweight. So we need to maintain a healthy weight. That's very important in preventing heart disease.
Thank you.
My pleasure.